Your jaw is holding your stress. Here is what it does to your body. How many people wake up with jaw pain, headaches, tight shoulders, worn teeth, or constant facial tension without realizing their body has been stressed all night long? Most people think stress only affects the mind, but one of the first places chronic stress often shows up is the jaw. And today we are going to talk about something that millions of people experience without even realizing it: jaw clenching and teeth grinding. What it does to your body, why it happens, how it connects to stress, sleep, the nervous system, TMJ, headaches, and most importantly, what your body may be already trying to tell you. One thing I've noticed in practice is that many patients don't even know they clench. They come in saying, I wake up tired, I've got aches and pains in the body, my jaw feels heavy, I have headaches, migraine kind of headaches, my neck is always tight, my teeth feel sensitive. I don't know why I'm getting gum recession, or I don't know why my teeth are wearing down. And very often, the body has been under stress for a long time. Sometimes emotional stress, sometimes poor quality sleep, sometimes airway issues, sometimes nervous system overload. And the jaw quietly becomes the place where the body holds tension. What is bruxism? So, first, what exactly is bruxism? Bruxism simply means clenching or grinding the teeth, and it can happen during the day, during sleep, or both. Some people grind side to side, some people tightly clench without movement, and many people are doing it unconsciously. Now, occasional clenching can happen to anyone, but chronic clenching over time can create a lot of stress on the jaw joints, muscles, teeth, neck, even the nervous system. And the difficult part is, many people don't realize it's happening until symptoms become more obvious. The nervous system connection, what goes on here? There are some things become really interesting here. Jaw clenching is often not just a dental problem, it's very commonly connected to the nervous system. When the body stays in a prolonged stress state, the muscles never fully relax, and the jaw is one of the most common places where that tension gets stored. That's why many people notice jaw tightness during stressful times, clenching while working, headaches after long days, tension near the temples, neck stiffness, shoulder tightness. The body is essentially staying in protection mode, and for some people, this continues even during sleep. How stress shows up in the mouth. As dentists, we often see signs of stress inside the mouth before patients connect the dots themselves. Yes, that happens. For example, worn teeth, gum recession, flattened biting surfaces, cracks in teeth, scalloped tongue, jaw muscle tenderness, cheek biting, TMJ strain, headache. And many patients are surprised when we ask, have you been under stress lately? Because the mouth often reflects what the nervous system has been experiencing quietly for months or even years. TMJ, headaches, and morning pain, yes, they're all connected. One major area affected by clenching is the TMJ, the temporomandibular joint. This is the joint connection, the jaw to the skull. When the jaw muscles stay overloaded repeatedly, the joint itself can become strained, and this may contribute to jaw clicking, pain while chewing, headaches, ear pressure, facial tension, difficulty opening the mouth comfortably. Many people also wake up with pain worse in the morning, and that's often because the clenching has been happening throughout the night. The sleep and airway connection. Yes, let's talk about it. Now, here is something many people don't know. In some patients, teeth grinding may also be connected to breathing and airway issues during sleep. When airflow becomes restricted during sleep, the body may subconsciously activate jaw muscles in an attempt to reopen the airway. So sometimes snoring, mouth breathing, poor sleep, fatigue, weight gain, jaw clenching, headaches may all be connected together. This is one reason airway focused dentistry and sleep dentistry are becoming increasingly important today. Because sometimes the teeth are not the root problem, the airway may be involved too. So, here are simple three things to start noticing in yourself. 1. Morning symptoms. Do you wake up with jaw tightness, headaches, dry mouth? sore teeth, fatigue, facial tension, that can be an important clue. 2. Daytime clenching. Pay attention during work or stress. Many people unconsciously hold their jaw tightly together throughout the day. Your teeth are actually not meant to touch constantly. 3. Wound teeth or tension. If your teeth are wearing down quickly or you constantly feel neck and shoulder tightness, your jaw may be carrying more stress than you realize. One of the biggest shifts happening in modern dentistry today is this. We are realizing the mouth is not separate from the rest of the body. Jaw clenching is often not simply about teeth, it may involve stress, sleep quality, breathing, nervous system overload, posture, inflammation, airway health. And this is why treating symptoms alone often isn't enough. We have to understand what the body is trying to communicate underneath it all. So, if you have been experiencing jaw pain, headaches, wound teeth, gum recession, tension, fatigue, aches and pains in the body, clenching, and poor sleep, don't ignore those patterns. Your body may have been adapting to stress for a long period of time, and sometimes the jaw is simply where that stress becomes visible first. If this video helped you to understand jaw clenching differently, share it with someone who constantly says, "My jaw always feels tight," because many people are dealing with this without even realizing it. And if you would like to learn more about airway health, TMJ, biological dentistry, stress patterns, and whole body oral health, follow for more educational videos.